station, the original hip-hop doc. Don't you deny it. Check out my curriculum vitae. I can surely supply it. Trying to take my name, sir? Don't even try it. I've been curing ills for years before you even die. Live in the studios, WYZE. Tune in and dial up if you have a question for me. I can understand why you tried to be me. A hip-hop doctor's a bomb and the best as far as the eye can see.
And good afternoon and welcome to this episode of the Ask Dr. MJ. Why? Because your health is important. Facebook Live, Instagram Live, YouTube Live broadcast where you, the listener and the participant, get to ask your healthcare questions. This is our second broadcast for the year 2025. We got a little weather problems down here in Atlanta, but we are surviving. I hope you are as well. So today, we're talking about this problem or this recent information that's come out that's got everybody afraid, talking about alcohol and whether it's safe to have a cocktail or not. So you've heard about the alcohol and its effect on the body. So let's go over the topic that many of you, I'm sure, are concerned about, or at least would like to hear about. There was a report that was released by the National Academies of Science and Medicine. And it's available online if you want to view the full report, but it was misquoted, really. And people were just, calling me, and a lot of my patients were asking me about it. It says that, alcohol is linked to this, that, and the other thing. And should they be drinking at all? So let's go over the specifics because I want you to have the current real information. Remember, that's what we do. We make it plain, keep it real so that you know exactly what's going on in the world of health. We always give you the most recent information and we don't cut it. We don't mute it in any way. We give it to you real. So that report noted that there was specific evidence of a relationship between moderate alcohol consumption and specific health outcomes. So moderate alcohol consumption is defined. This was the key part of the study. You need to define what moderate alcohol consumption was. 2 cocktails per day for men. That's 2 beers, 2 glasses of wine, or 2 shots of alcohol of any type. That could be bourbon, scotch, tequila, vodka, whatever you like. Two drinks of that, whatever that is, and 1 drink per day for women. Now, I've always wondered why that was the case for women as well. I thought it was related to the body fat content, but it's not. It's related to the amount of water or fluids that's in the body. Men have more fluids in their body, so basically it dissolves alcohol and makes it weaker. And that's why it's recommended that men can have 2 cocktails without usually having any substantive or significant impairment. And women can have 1 without any substantive or significant impairment, although I know ladies that can drink more than that and don't seem to be impaired at all. So the base difference, again, is between the water content of the bodies of men and women. So weight changes, the evidence show that the BMI and the risk for being overweight and obesity amongst women is inconsistent. So that means is drinking related to weight gain or weight loss. And there doesn't seem to be any real relationship between that. As long as it's moderate alcohol consumption, doesn't negatively impact. I hear people saying, I'm going on a diet, I'm going to stop drinking. And I say you don't have to do that. You just have to avoid certain drinks, not because of the alcohol content, but because of the amount of sugar and calories. Now, tequila is one of the absolute best alcoholic beverages that you can have. It's safe for diabetics. It's safe for people that are dieting, all kinds of issues. But the most popular drink that's made from tequila is a margarita. And a margarita is one of the highest calories cocktails that you can have. So it's not, again, the alcohol. The alcohol serving is 1.5 ounces, or is 1 ounce or 1.5 ounces, depending upon how you like yours. But when you do that, it's the alcohol content. It's the sugar versus the alcohol content. So no direct relationship between moderate alcohol consumption and your BMI gaining or losing weight. Cancer. The consumption of moderate amounts of alcohol is associated with a higher risk of female breast cancer compared to those that never consume alcohol. So the thing is that there's some questions about that study because people that don't consume alcohol usually have a much healthier lifestyle than people that drink on occasion. So it's not just that they don't drink alcohol. They usually exercise more, get better rest. Just the entire lifestyle is better. So to single out the alcohol consumption as the connector to cancer is one of the questions that people have. Although there's a particular genetic variant that a woman can have that predisposes her to breast cancer that does seem to be triggered and or activated by high alcohol consumption. But other than that, not a problem. And then drinking higher amounts of alcohol, more than 5 cocktails a day, has been related to colorectal cancer increased numbers as well. Now, cardiovascular disease, everybody always thinks that, oh no, alcohol can cause problems with heart attacks and strokes. But when they compare people that never drink alcohol or say they never drink alcohol versus those that consume moderate amounts of alcohol, there's 2 cocktails per man, 1 per day for women. That's actually associated with a lower risk of heart attack in women. So that is absolutely a great benefit. Lower incidence of heart attacks and lower risk of non-fatal strokes in both men and women. So lower risk, moderate alcohol consumption. This is what's been said in the reports from the FDA for years and years and years. But now it's been verified by this recent study. Now, neurocognition. Is alcohol consumption related to onset of Alzheimer's disease or dementia? And there's no conclusion that can be drawn that connects those two. So the bottom line is that once again, we're back to where we have always been, that moderate consumption of alcohol has benefit for you, decreases the incidence of heart attacks and non-fatal strokes. So you want to, it's safe to drink in moderation. And that's what we've always recommended. And that's what we do. And it doesn't matter. Now, the best beverage, of course, continues to be red wine. But if the benefit from red wine is a 10, then the benefit of Jack Daniels, Hennessy, and tequila is 9. So it's not a substantive or significant difference between the type of alcohol. The alcohol itself inherently can have benefits for you. So again, if you are diabetic, tequila is one of the best. And then there are vodkas that are made that are non-carbohydrate based. So that is good as well. But cocktails and beverages that are made from sugar like rum are not good, particularly if you mix it with your mixers or sodas. So like a rum and Coke, not a good cocktail for a person that's diabetic to drink. So it's okay to have cocktails, but you just got to be careful and conscientious about the cocktail that you take. And usually, ladies, if it's the sweeter it is, the more girly it is, as you like to say, the more ingredients in it, the more calories that are in it as well. So the things that you put in there to make it sweet, bubbly, and to taste like soda are the things that put the excess calories in there, which can cause problems with everything from increasing your blood pressure to causing weight gain. So very conscientious about that. So that was a great topic. And again, I hope we have allayed your fears that it is okay to have 2 cocktails per day for men, 1 cocktail per day for women. Now you can't store that up and say, well, I didn't drink on, 2 days during the week, so I'm saving it up so I can have 6 cocktails on the weekend. That's not the way that it works. But I know that particularly doing things like football season, when you may sit there and watch 3 games in one day, and if you like to have a cocktail, you probably are having more than 2 or 1 for a lady. So, that technically can be classified as binge drinking. But I would say, life is short, enjoy it if you want to enjoy it. But once football season is over, just resume to a more healthy option to do so. All right, Heidi, let's get to it. Let's do a roll call and see who we have that's on the line right now. So good to have you here, and thank you for participating. Winnie King, how you doing? Sending more and more blessings our way. Thank you so much, Winnie. We appreciate you from Terrell, Texas. Trish Summers, Trish, where you calling from or where you logged in from? We want to know. Okay, Rhonda Holland Young. Okay, everyone from Tyler, Texas. Texas is represented and in the house tonight. Christine Alexander, good evening from Miami. Miami, great. We love Miami. I need to be in Miami right now because it's cold outside. C. Bracy, Carolyn from Virginia. Okay, Carolyn, thank you so much. We appreciate you. Cedric Trotter. Hi, Cedric from Chi-Town. I love Chicago, one of my favorite cities, but not this time of year. Miss Makiba Boland, good evening. Thank you so much for tuning in. As always, we appreciate you. Glenda Everett from Warner Robins. Hi, Glenda. Glad to have Warner Robins back representing. Warner Robins is south of Atlanta, so that's in Georgia. Love Jones. Hello, Miss Corey from St. Louis, Missouri. How you doing, Miss Love Jones? We appreciate that. Roger Taylor from Swifttown. Is that Mississippi? All right. Glad to have you, Roger, as well. Roger Dodger, David Holloway. Good evening, David. Glad to have you following up with us as well as, you just a wonderful person for being here with us this evening. Okay, let's Leonard Jenkins. Good evening, Leonard. We're so glad to have you here. I'm gonna see if I can recenter this camera a little bit so that we have a better view. Okay, there we go. I think that's a better angle. Sean Big Time Green, my main man, tuning in, one of my first. Shy Wilson from Oklahoma. Hi, Shy. Thank you for joining us as well. Yvette Gunner from Mount Airy, North Carolina. Mount Airy, that's close to Mount Pilot. Ricky Nelson, Mississippi in the house. MISSISS. Libra Love Laughter. Howdy, Joan from Tampa. Hi, Tampa. I'm coming to Tampa to do a speech at the Children's Hospital there. I'll put the word out when I'm on the way. D Hall, Fort Lauderdale, Florida. It's chilly here too. Yeah, Fort Lauderdale, it is. April Striggers from Fort Lauderdale as well. Vicky Mathis, hey, from Austin, Texas. Okay, Vicky, we're so glad to have you now. Tanya Patterson from Dallas, Texas. Hi, Tanya. So glad to see you as well. Okay, let's get to it. This is your show. It's your opportunity to ask your healthcare questions. We're going to try to be entertaining, give you infotainment, answer your questions, your satisfaction. Remember, if you have a question, more than likely, there are hundreds or maybe even thousands of people that have that same question. So you are sharing that information with them. And once again, I'm saying, once you have been empowered with knowledge, share that knowledge. Don't just keep it to yourself. Call your friends right now. Tell them to tune in. They can get this free healthcare information. But more importantly, when you're in a group situation, when you've gathered with friends, when you've gathered with family members, we want to make sure that you are sharing this information. You can say, Dr. Collier said, quote me exactly. And people can look up, they can go to the YouTube channel and see this video and many others. We break it up into various topics. So you get a chance to ask your healthcare question. Okay, let me get a sip of water. Okay, let's do it. My sister's 50 years old and has not had a menstrual cycle in 3 years. She has started a cycle recently and is bleeding heavy. She went to the doctor. They want to do, okay. Your sister was 50 years old. She stopped bleeding for 3 years. That is by definition, the definition of menopause. Menopause is when you have not had a cycle for 1 year. Having not had one for 3 years and now all of a sudden bleeding heavily is not a good sign. The most common phenomena during which this happens are fibroids of the uterus, but there are other things that need to be ruled out. So she's going to need an ultrasound of the abdomen, possibly a CT scan, but they really won't know until they get in there and get some tissue. So it's going to require invasive pap smear where they get what's called an endometrial biopsy to do that. But she may get, from the ultrasound itself, it may show 1 fibroid, 5 fibroids, the most common reason for you to have that abnormal bleeding. But bleeding, period, particularly heavy bleeding like that, is a sign that something needs to be done. You can really become quickly anemic and, start having problems with lightheadedness, dizziness, particularly while walking, rising from a sitting position or driving even. So she needs to take it seriously with some sense of urgency to get, 1, the answer as to what the etiology is, and 2, to fix the problem. It may be as simple as going on hormone therapy to stop the bleeding. It may be as challenging as needing to get a hysterectomy. You just don't know until you get in there and work it up, so to speak. So she needs to be seen by an OBGYN, a GYN specialist at this point at age 50, and then have that done, starting off with a routine pelvic exam and a pap smear to see what's going on down there. All right, great question. Tiffany Govan, do you have any recommendations for severe acne? We've tried all the topical creams. We've heard of Accutane, but taking something that has to be registered with the government is scary. Thank you very much. I agree, Miss Tiffany. Acne is a simple staphylococcal infection of the skin. In adults, it can happen. The most common reason that it happens is exposure to dirt from your own hair or a dirty pillow or pillowcase. So we need to make sure that we're putting a doily over the pillow or that we change the pillowcase regularly. More importantly, don't put your face in the pillow. Get the hair out of the face, and then at night sleep with your face straight up. Don't sleep with even the side of your face in the pillow because that can aggravate it. A lot of people don't use soap when they wash their face. You need to use an antibacterial soap such as Dial or Liber 2000, the white bar of Dial, which does not contain lanolin. Lanolin is made from sheep's wool, and sheep's wool makes most Black people itch. It's highly irritating to the skin. So a non-lanolin or a lanolin-free antibacterial soap. And then there's a product that Dr. Collier recommends. I actually buy it from the dollar store. It is called Acne Wash, ANCE Wash, WASH. It comes in a bottle about the size of a hand sanitizer. The bottle is square. It is absolutely incredible. The same product in a regular drugstore probably costs you anywhere from 30 to 60 bucks. It's $1.25 at the dollar store. When I go, I buy at least 5 to 6 bottles every time, so I always have it around. I keep it at my office. I keep it at my home. After I shave my face in the morning, I wash my face with this acne wash. When I wash my hair, I wash my face with the acne wash. Before I go to bed at night, I wash my face with the acne wash. And I have decent quality skin, and I did suffer from acne and had acne, of course, as a kid, but adult acne as well before I discovered this product. And so something as simple and elegant, if you're susceptible to acne, this is a maintenance problem. So you can treat it, it clears up, but then it comes back because you stop doing those things. So it requires a regular regimen to do so. I also recommend after washing the face that you use witch hazel as an astringent. It doesn't sting, burn, it doesn't dry the skin out like alcohol will, but witch hazel, which you can also buy at the dollar store for $1.25. And then using hypoallergenic makeup for the ladies. Hypoallergenic, it means it's sterile, it doesn't have anything in it that's comedogenic, which means it plugs your pores, it makes acne appear. So non-comedogenic, hypoallergenic, and of course there are several brands that do that now. There used to be one called Fashion Fair. I think they have been revitalized, but then there are others as well, but you have to make sure that they have skin tone colors that match your skin tone. But other than that, and that's everything from mascara to eyelash, base, everything has to be hypoallergenic. You can't buy one product and do that. Unfortunately, you can't get that at the dollar store. But there are places that you can get it, places like Target, etc., that have decent deals on makeup, and you can do that. But it will require great maintenance. If you just add that acne wash to your treatment protocol, I promise you in 2 weeks you will have new skin. I promise you will have new skin, or the person you referred to, which could be a child, a daughter, whatever, in doing so. So severe acne, again, if you rub it too aggressively, you can scar it, and that needs to be treated in a variety of other ways, including laser therapy. But again, topical creams usually don't work because the problem is underlying staphylococcal bacteria that's on the skin. And again, people that oftentimes you can look right at their hair. If the hair falls across here, that's where the acne line is, right along the line of the hair. If they wear the hair back, of course, not a problem. So you got to make sure that at night that hair is bundled and not allowed to touch the facial skin. Oh, but it's a process. But again, we'll have that skin flawless in a couple of weeks if you do those things. All right, great question, Tiffany. April Striggers from Fort Lauderdale. One of my mother's kidney count is lower than the other one. What can she take to get her kidney count up? There are several things. If your mother is diabetic, the medications that are SGLT2 inhibitors, those are Jardiance and Farxiga, have great benefit for kidney function. There's also a medication called Corindia that is indicated if you have diabetic nephropathy. So if she's not diabetic, she can't get the Corindia, but you can actually get those other two medications, Jardiance or Farxiga, as a non-diabetic, because they now have an indication for treatment of kidney disease. What's amazing and incredible is when these medications were first discovered and brought about, they were afraid to use them in people with kidney disease because they thought they might cause more damage to the kidneys. What they learned was not only do they not damage the kidneys, they actually improve renal function. So your kidneys improve while taking those medications. But guess what? Something very simple and elegant helps kidneys better than anything else you can do. That is drinking 8 to 10 glasses of water per day. 8 to 10 glasses, not counting anything else that she drinks. So people say, Dr. Collier, if I drink that much water, it's going to have me urinating all of the time. Exactly. We want to put those kidneys to work and keep them working. And the biggest problem that most older people have is they cut down their water and fluid intake because they don't want to get up and go to the bathroom, or they're concerned about possible incontinence, leaking stress incontinence when they cough or sneeze, or wetting themselves publicly. So make sure that that's not part of the problem. If it is, just deal with it however you deal with those things. And that will be some kind of padding or some kind of something to catch the urine. But more importantly, it's more important to keep those kidneys functioning. Think of kidneys as like running a car engine with low oil. The car will still crank, but eventually it starts to do damage to the car engine, and that damage over time will become permanent. Your kidneys are the exact same way. The test that you're referring to is called the glomerular filtration rate, or GFR. That's the most important kidney function test. There are two others: blood urea nitrogen, or BUN, and the creatinine. The creatinine goes up, that's an indication of dehydration. You need to drink more water. The glomerular filtration rate goes down, which is the rate. It tells me how effectively and how efficiently your kidneys are functioning. And guess what? If there's not a lot of fluid to filter, then you have a low filtration rate. So you want to make sure that there's lots of fluid to filter. So drinking lots of water, avoiding NSAID class medications, that's ibuprofen, Motrin, Advil, Aleve, Tylenol, perfectly safe. You can take Tylenol at doses as high as 500 milligrams, 2 tablets, up to 4 times per day without doing any damage to the kidneys. But ibuprofen, Advil, naproxen, Aleve, prescription strength, naproxen sodium, or ibuprofen, all of those things are to be avoided when you have kidney disease, because they will cause further damage to the kidneys. So it's going to be, she starts drinking that water within the next few months, and she follows up with the doctor, those numbers will be improved, I guarantee it. And then that's a simple and elegant way. The kidneys and the liver are two organs that actually have the ability to heal and repair themselves. They can regenerate. No other organs in your body can do that, but the kidneys can do it. So if there's damage to the kidneys and the damage is not too far along and not permanent, the kidneys can repair and heal themselves, particularly if you control the two disease processes that affect the kidneys most. That's high blood pressure and diabetes. So if you're diabetic, you control your blood sugar. If you have high blood pressure, you control your blood pressure, and that will also help with renal function. Great question, April. Thank you so much. Tell mom that we said hello, and we'll be praying. Rhonda Holiness Young, what is autoimmune hepatitis versus a fatty liver? Well, fatty liver is where fat is deposited in the liver and fat cells start to push out normal liver cells. Two things cannot occupy the same space at the same time. So when that happens, you have decreased liver function just from the phenomena of having fat cells replace liver cells or hepatic cells. Fat cells will not filter. They do not form a detoxifying, they don't have a detoxifying ability. And the thing is that if you are gaining weight, overweight, obese, fat gathers everywhere inside the abdomen, around your organs, on top of the abdomen, and literally within the tissues of the liver itself, because the liver is nothing basically but a major filter for the blood. So as fat cells are circulating in the blood, they can get trapped in the filter of the liver, deposit themselves there. They're getting bathed in blood all of the time, which is full of nutrients, so they continue to grow and thrive. The problem is they shouldn't be there. So it creates the fatty liver situation. Now, autoimmune hepatitis is where your body stops recognizing itself as self, and it starts to look at parts of your body, various types of organs, or various organs, as not you. It's kind of like getting a kidney transplant that doesn't match, or a blood transfusion that's the wrong type of blood. Your body starts to reject. The rejection phenomena is one where antibodies will attack those tissues. In autoimmune situations, it's your own antibodies attacking your own body because they do not recognize the body as self. The damage can be extensive. The immune system overacting in this way, you treat that by muting the function of the immune system. The problem is that when you do that, you also limit the ability of the immune system to fight infection, viral infections, bacterial infections, fungal infections, and it predisposes you to different types of cancers. That's why people with autoimmune hepatitis in particular are susceptible to liver cancers. So it's imperative that they make the correct diagnosis, two, they treat, because if it's fatty liver, it's just going to require a healthy diet and some cholesterol lowering medications to help decrease with that. But remember, like I said, the liver and the kidneys have the ability to regenerate. They can heal themselves if the damage is not too far along. If you want to say late stage 3 or stage 4 of those circumstances, and again, just allow it to heal, monitoring and controlling those disease processes that can also affect the liver. Okay, great question. Cedric Trotter from Chicago. I'd like to know if there's a way to rid the body of mucus and acid. Boy, Cedric, if I could answer that question, I could retire, because everybody, as we age, everybody's getting mucus and asking me, Dr. Collier, I have mucus, I have congestion, I lay down and I have postnasal drip, and I'm constantly doing that. And so they feel the mucus, they have to expectorate the mucus. The mucus does serve a function. Say, for instance, in your stomach, a mucus lining inside the stomach, below the esophagus, and just inside the stomach proper, protects the stomach from digesting itself. In your respiratory tract, your sinuses, your bronchial tree, your lungs, the mucus traps bacteria, viruses, dirt, debris, things that you breathe in that shouldn't be there, holds them in place, and then there are hair-like projections called cilia that literally have a function. They beat like this, and all in synchronized way, like synchronized swimmers, to bring mucus up out of your chest, so it gets in the back of your throat, and you can cough it up, hack it up, etc. So it has a function. Excessive mucus is a problem that's usually associated with allergy. So you need to take a non-sedating antihistamine that will break up mucus, but also a mucolytic, such as Mucinex. Mucinex make thick mucus thin and watery, so you can cough it up, hack it out, and get it out of your body. Either way, do not hack up mucus and then swallow it, because of that mucus is full of dust, dirt, debris, bacteria, or viruses. Mucus that was in your chest is now in your stomach, and it can infect your GI tract, causing gastroenteritis, nausea, vomiting, diarrhea. So when you have to expectorate, spit it out. Don't spit it out on the sidewalk. That is a public health disaster. All kinds. That's one of the reasons they had big tuberculosis outbreaks, because people would hack up TB-filled mucus and spit it on the sidewalk. It would dry out, become aerosolized, and then the next person walking down the street would breathe it in. So you want to make sure that if you have to expectorate, you do so in a tissue, discreet tissue, bottle up, throw away. Don't use the same tissue over. Don't use a snot rag. Most disgusting, but people will carry handkerchiefs in their pocket and continue to use them. You do not want to carry bacteria around in your pocket. So something disposable, Kleenex tissues in a box. You use it, you throw it away, and then get that mucus out of your body and system. So non-sedating antihistamine, loratadine, Claritin, fexofenadine, Allegra, levocetirizine, Xyzal, and cetirizine, Zyrtec. All of them are now over the counter. They actually have generic versions available in the store, where everything's $1.25 now, and you can buy and load up, keep it at your home. When people call me, I ask them, I say, what do you have at home right now? And if they don't, I say, look, load up, stock up, so that when you call me with those types of symptoms, tell me what you have and I can instruct you. But I would recommend that you keep a non-sedating antihistamine at home, and that you keep maximum strength Mucinex DM, which has dextromethorphan, which stops you from coughing, those tablets. But you can buy Mucinex in as little as 400 milligrams. You'd have to take 8 of those a day to get any real benefit, and that's a lot of pills. And it sounds like everybody will do it the first day or so, but once you start to get pill fatigue, because that's also not the only thing you're taking. So you want to take more than that. So get the maximum strength, which is available over the counter, and it has 1,200 milligrams of the guaifenesin, which is the mucolytic, in it, along with 60 milligrams of dextromethorphan. So 60, 1,200, and you can take 1 or even 2 of those, depending upon how congested you are. But I have people that literally have to, they just literally have to take it every day, so that they can stay clear enough that they're not coughing and hacking all the time. Great question, Cedric. Okay. Julia Washington, I was diagnosed with osteoporosis and prescribed Fosamax. My question is, can I take something else like supplements to help? Absolutely, Julia. Great question, because the Fosamax will help slow down and help treat osteopenia, which is low calcium in the bone. Osteoporosis is when you have full-blown lytic lesions in the bone. The bones are weak. You are susceptible to fractures. You slip and fall, where most people would get up and walk away from it. You have a fracture of the hip, the femur, or the leg. So it's important that the Fosamax help with that. But vitamin D is key. You need vitamin D. Vitamin D is kind of the building blocks to help you build the calcium. If you want to say, if you see a brick wall, it's the cement that holds the bricks together. The calcium being the bricks, the vitamin D, the building blocks, the glue, if you will, the cement that you lay the bricks with. So vitamin D at a dose of 5,000 international units per day. Not readily available over the counter. You go to the website lipodrops.com. Go to lipodrops.com, the official website. Go to lipodrops.com and get the information that you need on vitamin D3. Vitamin D3, which is the most efficient and effective form of vitamin D. Vitamin D2 is available as well, but vitamin D2 has to be converted to vitamin D3 before you get benefit from it. Now, some people's bodies do that very efficiently. Some people's body do it okay, but not really efficiently. Some people's body don't do it well at all. So just to take away that issue or concern, don't get the D2, get the D3, vitamin D3, and that will give you the benefit that you need. So you should be on vitamin. I'm shocked they haven't told you to do that anyway, but you definitely need to be taking vitamin D3. Go to the website, take that along with the Fosamax. We don't want you ending up with a bone fracture. And also, you start to get compression fractures in your back. You can get those. You can get the hump in the back. You get, the forwarding of the neck. So you have to hold your head up with effort because your head tilts down. The weight of the head is not being supported by the bones in the neck. So you want to make sure that you're dealing with all of those things. Okay, Julia, great question. Cynthia Jones, 57, half black and Asian woman. I've experienced issues with fibroids and polyps. I'm worried about potential side effects from removing my reproductive organs after hysterectomy. All right, Cynthia, you can have or get a second opinion from a physician that's known as an interventional radiologist. Amazingly enough, they deal with these fibroid issues through a process called uterine fibroid embolization. What that does is they put a catheter in your lower abdomen or even your thigh. They thread that catheter through the veins in your pelvis until they get to the uterus. Once at the uterus, they block it has some tiny microscopic sized pellets in it that block and cut off the blood flow to the fibroid. So the fibroid ultimately sloughs off. It basically dissolves, melts, and then you pass it through the uterus, but the fibroid is gone. It is very effective in treating this disease state without you having to get your uterus removed. And then when you say your reproductive organs, that means they're also planning on taking your ovaries, which they don't have to do. But if you're 57 and your ovaries aren't working, then keeping them there just stops it from becoming a problem later from some kind of ovarian issue. But that can be determined by hormonal tests. 57-year-old is not too old to have good ovarian function, particularly if you got some Asian genetics in your system. So you want to do that. So look for an interventional radiologist. Google, if you want a name, Dr. John Lipman, Lipman. He's in Atlanta. He can give you some more insight into this. His office is called the Uterine Fibroid Embolization Center. And it is absolutely incredible what that can do. That technology is amazing. It's minimally invasive, which means you're not having to be cut open. You're not having to have a lot of downtime to recover. You don't have a sore abdomen. The problem is just dealt with. And it takes a few weeks for the uterus, for the fibroids to slough off, as we call it. But it's much less invasive procedure, and recovery time is much less than getting hysterectomy. So if your doctor has not brought that up to you as an option, there are times when it is not an option for various types of reasons, but most of the time it is an option. But if the doctor, particularly a GYN, does not do that procedure, then they're not going to offer it to you. Doctors offer you what they do and what they know how to do, and that's usually what they offer you as the only option. They don't say you could do this, you could do that. I do this, and this is what we're going to do. So this is an opportunity where a second opinion may be valuable to you. So an interventional radiologist, Google that near me, or just go to Dr. John Lipman, Lipman. He can advise you, or even he's worth coming to Atlanta to see. I think you'd be glad that you did. Tell him I sent you. He'll treat you like a queen. Cynthia. Great question. C. Bracy, what's the best way to help reduce belly weight? Lose the muffin top with Lipodrops. Lipodrops is the only supplement that you can get in the maximum strength formula, which allows you to lose weight from places you cannot traditionally exercise the weight from, such as under the chin, across the back area, the bat wings here, in the bra area, the belly fat where you can pinch an inch, the inner thigh, the outer thigh. The problem with fat disposition is that once you are older, if you will, middle age or older, then estrogen levels go down. When estrogen levels go down, your body starts focusing fat disposition into those areas. That's when your body ages. You haven't changed what you eat. You're still relatively active, yet now your stomach is growing, your abdomen is growing. It's not fibroids, that's abdominal fat. Well, the lack of estrogen causes disposition of fat in the abdomen in particular, but also inner thigh, outer thigh, underarms, and back fat. So the Lipodrops maximum strength formulation is ideal for that circumstance, but also our newest product, the Liponites, which literally contains 3 lipolytics. These are supplements that burn fat. You burn fat at night while you're sleeping. One of the other things that contributes to abdominal fat is the cortisol stress hormone. If you are not getting a good night's sleep, cortisol levels go up, and this causes direct disposition of fat into the abdomen. And this is the worst kind because it is under the abdominal muscles and it is affecting your abdominal organs as well. So very important that you do that. It also contains melatonin, which helps you get a good night's sleep. So if you're sleeping well, you're not having to fight the cortisol hormone because you're getting restful, restorative sleep. But you also now have 3, count them, 1, 2, 3 lipolytics that are burning fat in the belly while you sleep. So you take the Lipodrops, 1 dropper full under your tongue, hold under your tongue for 2 minutes before each meal. This is the way, an appropriate way to do it. I had a patient today. They said when they use the Lipodrops, they haven't, this is a man. He said that he has trouble holding it under his tongue for 2 minutes because it creates saliva. It might, but it's not going to create so much saliva that you can't hold the bulk of the Lipodrops max under your tongue and then swallow it. The thing is, when you swallow it, it does nothing in your stomach. Once you swallow it, that is the end of the process. It works by being absorbed under the tongue. It is the equivalent to coming to my weight loss center and receiving an injection of a medication called Lipobite. It is almost the exact same composition. As a matter of fact, our regular or original Lipodrops formulation was the exact formulation of the Lipobite injections. The purpose of that, instead of having to come to the weight loss center to receive an injection, you could get a 1-month supply of the same medication in a bottle and take it every day, and versus getting a shot every 2 weeks, and you find that you get better response by using it every day before each meal. Then we had patients that were using the Lipodrops regular strength and saying, well, if 1 dropper full works good, then 2 dropper fulls will work great. So they started taking higher doses. And Dr. Collier did not recommend that, but they did, and they had great response. So we did a little research, evaluated it, found out that we could up the strength. We created the Lipodrops maximum strength formulation that you have. You take under your tongue, and I was looking to see if I had a bottle around, and then you hold it on your tongue for 2 minutes. You take that. That in combination with the Liponites will give you the great benefit that you're searching for. Go to the website, lipodrops.com. You can get all the information that you want right there. Okay. Lydia McGee from St. Louis. I have thyroid goiter despite normal thyroid panel test. Would like to know more about causation. At times it hurts and I gain weight amongst other issues. Lydia, great question. Thank goodness you have normal thyroid hormone, but the thyroid goiter, that means it's not active. It's not creating additional thyroid. It's probably limiting the thyroid and keeping it on the low side of normal, which can cause problems with weight gain. Then as it swells up, you may start to have difficulty swallowing. This is the thyroid gland here. It's a butterfly-shaped gland that sits right on top of the early first portion of your bronchial tube there. It comes up like a butterfly shape, just like a butterfly out to here. You can feel it. You can feel the center of it here, and you can go out to each lobe just by palpating with the tips of your fingers there. You can feel the outline of thyroid. If it is asymmetric, one side is bigger than the other, that is usually caused by a goiter. Now, a goiter can be debulked. It can be anything from taking out the entire thyroid, which I would not recommend. Sometimes they'll take out half of it. They'll take out the lobe that's affected, or they'll take out the bottom or the top half. It just depends. So it can be precisely debulked, removed, or whatever. There's nothing that you can take that will shrink it. There's no pill, no medicine, no technology. You have to cut it out and remove it if it's that big of a problem. If not, I would definitely monitor my thyroid hormones at least every 3 months and to see if it's negatively impacting you. You also need, beyond the traditional TSH, which is thyroid stimulating hormone, that is the test that just tells, that is the compound that tells your thyroid to make more thyroid. That is not thyroid hormone. So I'm hoping, particularly with the goiter, that you are having a complete thyroid panel, which includes the T3, which is the active thyroid hormone, and the T4, which is the inactive. Just like the other hormone, the T4 has to be converted to T3 to give you the benefit. Some people do that very effectively. Some people don't do it well. With a goiter, the process may be muted. So you want to make sure that that's being evaluated. At minimum, you need an ultrasound of the neck to define the extent of the and size of the thyroid gland. There's a thyroid test that uses a nuclear activated compound. You get an injection of that in the arm. It goes through the body, and it's taken up in the thyroid, and then they can take a better picture of it. It's like the butterfly is a light, and they cut the light on, and you can see it quite well. So with the x-ray film, not just your neck is lit up when you're walking around. But so this needs to be in conjunction with an ear, nose, and throat specialist or an endocrinologist, somebody who understands and treats thyroid. The ear, nose, and throat will be the person that does surgery if it requires surgery. You've seen people that have a surgical scar here. There's a doctor in Atlanta named Dr. Titus Duncan. He does a technique where they go under the arm. He uses a laparoscope, minimally invasive technique that does not leave a scar on your neck. And he can access the entire thyroid, a portion of the thyroid. That's a very unique technique. He's one of the few people in the country that does it. And people don't offer you what they don't do. Remember that catchphrase. Doctors do not offer you things they don't do. So if your surgeon offers you a traditional thyroid, which will leave the necklace on your neck of the scar, then you need to find Dr. Titus Duncan or somebody else in your area that does that in St. Louis, that does it through that minimally invasive technique. If not, come to Atlanta. I tell people I will travel for surgery. If I have a doctor that does something nobody else does, it's worth the trip to come to this area or whatever your area is to find that person and not settle. Don't let, because surgery is a one-time thing. You don't let convenience impact your decision as to your therapeutic outcome, because this is going to be the way you are the rest of your life. And I know that people oftentimes regret going to the doctor that was around the corner versus the one downtown or the one on the other side of town because it was just more convenient. And you don't want to go. This is not the time for convenience. This is the time where you want the best of the best of the best. And to do that sometimes require traveling. It may be traveling across town. It may require traveling across country. But whatever it takes to get the best outcome, you want to make sure that you do that. Great question, Lydia. Okay. Shy Wilson, I want to ask you about the glucagon tablets. Is it good to manage blood sugars? I am type 2 diabetic with high blood pressure and cholesterol. Also, what would you recommend for skin? One, to help with skin, vitamin D and omega-3 fish oil, as well as vitamin E topical. There are lotions that contain vitamin E as in epsilon. There's vitamin E oil that you can buy at the store that everything's $1.25. Comes in a size of about 6-8 ounces. A great product. You can use it literally everywhere on your body. You can use it on your hair. You can use it on your skin. You can use it any place. It is a great not only moisturizer for the skin, but it also helps repair skin damage, gives your skin that youthful glow. The glucagon tablets I'm not familiar with, so I can't recommend them one way or the other. But the things to do, there's so many good ways to manage your blood sugar nowadays. Again, the SGLT2 inhibitors, such as Jardiance or Farxiga. If you have a diagnosis of diabetes and you're not on one of those medications, you're not being treated optimally. You might be being treated, but before you go get a glucagon tablet, I get the tablet that is gold. And those gold, that gold tablet is Jardiance, Jardiance, or Farxiga, Farxiga. In addition to helping control the blood sugar, they make you lose weight because what they do, the way they function, is they make you urinate out excess sugar. Well, not only do you urinate out the excess sugar, you also urinate out the calories associated with the excess sugar. So you literally are urinating out and losing weight because you're urinating out those calories. So that is literally magic because not only does it control your blood sugar, it makes you lose weight. Everybody loves that as I don't even want to call it a side effect. I would say a benefit that it makes you lose weight. And so, and what's magical about these pills is that when it's glucose dependent, the way that they work, which means if your blood sugar normalizes, so it's in the normal range, they automatically cut themselves off. So you don't have to worry about your blood sugar dropping too low, like that can happen with various other treatment options that are not so state of the art. But the state of the art treatment options should include an SGLT2 inhibitor, such as Jardiance or Farxiga. And then, of course, we all know about the GLP-1 injections that will be Ozempic or Mounjaro. Either one, they both work. The Mounjaro is a better molecule. It works on 2 receptor sites instead of 1, but they both work and work very well. You can see that from the number of people that you see in Hollywood and on television that are all using these shots and getting great benefit from them. But guess what? They also are the greatest benefit to actually lowering your blood sugar, lowering your hemoglobin A1C, and they have cardiovascular benefits. They decrease the incidence of heart attacks and strokes and improve kidney function. So literally everything you could possibly want in one treatment option, it addresses all of those things. Great question, Shai. Maxine Smith, I ordered your Immuno Pack, sea moss, and mushroom supplements. I exercise 4 times a week and have changed my diet. Should I continue taking? Yes. You should continue to take your blood pressure and cholesterol medications. None of those things in the Immuno Pack, the sea moss, or the mushroom address blood pressure or cholesterol. All of my supplements are just that. The word, by definition, supplements, means you're supplementing. These are in addition to, not instead of. So these do not remove the need for you to take prescription medications to lower or control your blood pressure. Does not remove the need to take prescription medications to lower your cholesterol. Although the one thing you didn't mention, the omega-3 fish oil will help lower cholesterol, increase the HDL, the good cholesterol, lower the LDL, the bad cholesterol, and lower your triglycerides. So omega-3 fish oil is one product that I do recommend, but again, not instead of, but in addition to get optimal improvement in your lipid function, your lipid test. You want to add omega-3 fish oil to whatever other regimen that you're taking. Doing aerobic exercise 4 times per week is ideal. You must have heard me say that, because to get any benefit from exercise, you have to get at least 3 times per week in. But if you can get 4 times per week, you literally double the benefit. So if you give the variable value of the benefit of exercise, the value of X, 2 times a week, which is what most people do when they go to the gym, is 0x. You get 0 benefit from that. 3 times, you get 1x benefit. That most people go Monday, Wednesday, and Friday, 3 times a week. They get 1x benefit, so you do get benefit. But if you go Monday and Tuesday, Wednesday off to rest, restore, relax, and heal, Thursday and Friday back in the gym, then the weekend you do whatever you normally do, house cleaning, yard work, washing the car, whatever, you get 2 times benefit. This is an amazing thing about exercise a lot of people don't know. And if you go 5 times, 6 times, 7 days a week, there's no substantive or significant additional benefit. So going every day, unless you're getting paid to do so, unless you're getting ready for some kind of competition like weightlifting or whatever, is not going to give you great benefit. So for people that work for a living, regular people, as I say, 3 times per week minimum, 4 times per week optimally, and a minimum of 30 minutes workout, a full workout for 30 minutes. But 60 minutes is what everybody strives for. Nobody does it for 60 minutes, but most of the time you're waiting for the next machine or whatever. So your actual workout time is usually 30 minutes. But you need to get in at least 30 minutes to get any benefit at all. Okay, great question. Ms. Love Jones, can you touch on H. pylori and what does it cause issues after 2 weeks of medications? Okay, the treatment protocol for H. pylori is 2 weeks of medication. Now it used to be up to 6 months of medication, but now it's 2 weeks, but you have to take 2 different antibiotics. The most common are amoxicillin. You take 4 of those a day, 2 in the morning, 2 in the evening. You take a medication that's like a mycin class drug. Biaxin is the brand name. Clarithromycin is the generic name. You take 500 milligram dose, 1 of those in the morning, 1 of those in the evening. So 3 of those, and then a proton pump inhibitor such as Nexium, Protonix, or Omeprazole. Take that as well. So we tapped them out 6-7 pills per day, every day for 2 weeks. That's a lot of pills in addition to anything else that you're taking. That's what will usually eradicate the H. pylori, which is a bacterial infection of the lining of the stomach. Now, the original thought process was that no bacteria, no virus, no fungus could tolerate or thrive in the environment of the stomach because it's so acidic. The same acid that digests all your food, a steak, anything else that you're eating, again, would automatically kill any bacteria, or so we thought, until we started doing biopsies and looking at it with an electron microscope and found that there's a type of bacteria, the Helicobacter pylori bacteria, that not only lives in that environment, but thrives in that environment. So it gives you a challenge. When that happens, that bacteria literally eats at the lining of the stomach or weakens the lining of the stomach. So the stomach acid that's in your stomach will literally start to digest your stomach and result in stomach ulcers or perforation of the stomach lining. This is a big problem and can be life-threatening risk from a GI bleed. So very important that you complete that treatment regimen. That usually will eradicate it. If it does not, you might have to go through it again. Or there are other medication options. One includes metronidazole for people that are allergic to penicillin and cannot take the penicillin, or literally the amoxicillin. It's not penicillin, it's amoxicillin. But if they can't tolerate that for whatever reason, then the metronidazole is an option as well. Also, doxycycline can be used instead of the clarithromycin. There are various treatment regimens. The short regimen is 2 weeks. The longest regimen is 4 to 6 weeks now, and it may require continued therapy. But oftentimes when you do that, you're sterilizing the gut. And so now you're having issues later because you don't have the appropriate bacteria that's required to digest your food. So you get digestive issues like acid reflux, or you get nausea because that food is sitting there not being digested. So it's just like if you put food on the sidewalk or in the garbage can. It's 98 degrees outside, the average body temperature being 98.6. So now you got live bacteria growing at 98.6 that's in that food, and it's just festering in your stomach because it's not being digested. So that can give you nausea, vomiting, diarrhea, all those problems. So one of the things you want to do is add probiotics. Our probiotic product is perfect because it contains multiple bacterial colonies, each one at the billions with a B, not millions, billions with a B of colony forming units, which is the unit of measure. Or you eat some Greek style or Activia brand yogurt once or twice daily until your stomach normalizes. Because oftentimes it's that the medicine has worked too good and it's sterilized your gut, and your gut needs bacteria to function appropriately in the digestive process. Okay, great question, Ms. Love Jones. Vicky Mathis, I'm going from Ozempic to tiripazide or Mounjaro. I'm concerned about side effects. Are they the same as Ozempic? Actually, Ms. Mathis, they are less than Ozempic usually. They can be the same or similar. The way that these medications work is by slowing digestion. Your gut slows down. Your stomach or your digestive tract is one long tube. Your mouth, your esophagus, your stomach, your small intestines, your large intestines, which is the ascending colon, transverse colon, descending colon, sigmoid colon, rectum. All of that is one space, one tube. And so when that slows down, because normally you eat food, it goes to your small intestines where it's digested, turns into what looks like vomit if you actually have to vomit. But that's part of the digestive process is when it stays in your body. Once it gets to your large intestines, the primary function is the reabsorption of fluid. So you want to take all that fluid that's remaining in there, put it back in the body so you don't get dehydrated, and then dispose of and dispense of the waste byproducts of eating food. When that process is slowed down, the benefit is you don't feel hungry. And because you don't feel hungry, the diet is very successful because every other weight loss option requires you to embrace feeling hungry. And eventually you get tired of being hungry, and the only way to relieve that is to eat. And most people start eating and then they overeat, so they lose 20 pounds, but then they gain back 30 pounds. That is the usual and customary thing that happens in a traditional diet program that's based on calorie restriction and the embracing of feeling hungry. Well, with Ozempic and the Mounjaro or tirzepatide, you don't feel hungry. That is the greatest thing about these diets and why they work in so many people, because you don't have to worry about feeling hungry. And because you're not eating, you don't eat and you lose weight. You literally melt. Mounjaro or the tirzepatide works on 2 different receptors. The Ozempic works on 1 receptor. And because it works on 2 different receptors, you get a different response. But because you're slowing the GI function, you're getting acid in the stomach, you're not eating, that acid is not digesting food, it's just sitting there, that can make you nauseated. So when that happens, to get that baseline nausea, you need to coat your stomach. The thing that I recommend is eating yogurt, Greek style or Activia brand, once or twice a day, particularly when you first start the medication until you get used to it, if you will. That helps amazingly resolve those symptoms, and it gives you the good probiotics to normalize your GI health. So you won't be having bowel movements as often, but when you do, they will be less foul and they will be larger and easier to pass. The things that I suggest when people are taking these medications is to take my probiotic product and also take my lipo cleanse, because you don't want to get constipated, which is one of the side effects of these medications. So you take the lipo cleanse. It's not a laxative, but what it is, it allows you to have large, easy to pass bowel movements on a regular basis. So you should be having bowel movement about every day by the 3rd day that you're taking it. You take 2 capsules with a full glass of water every morning upon awakening, 2 capsules first thing in the morning. And when you do that, its fiber content stimulates your gut and allows you to have a normal, easy to pass stool. So those are the things that minimize the potential side effects of these medications and will make your life very easy. When I use these medications in my weight loss facility, and when I recommend that to patients, the side effect profile is minimal or non-existent. Whereas before I started recommending that, everybody was complaining about nausea, abdominal pain, cramps, spasms, all kinds of issues that can happen with these medications. But it's also important that you titrate to the highest effective dose that you can tolerate over time. Don't be in a hurry to get there. The medication works wonderfully, but it still is a process. So you start off at the lowest dose. 4 weeks later, you increase to the next highest dose. 4 weeks later, you go up. Within 8 to 12 weeks, you can be at the maximum dose of either of these formulations, and you'll get great weight loss from it. Great question, Ms. Vicky. Okay, this will be the last question. David Holiday, is drinking cold pressed olive oil before bed good for you? David Holiday, drinking cold pressed olive oil any time of day is good for you. You don't have to take it at bedtime, any time of day. As a matter of fact, if you're drinking oil before bedtime and then you lay down on it, you might get reflux. So I recommend that you take it with your last meal of the day or after your last meal of the day, before you, at least 3 hours before you lay down, so that you don't have problems with reflux. This might not be a problem for you, but if it's not, as you age, it will become. But the primary question that you asked, is it good for you? Yes, olive oil is one of the best things that you can do to improve your cardiovascular fitness. It is a natural anti-inflammatory. It also helps stimulate the gut, not in a way like castor oil. It won't give you diarrhea, but it will make you feel better and last longer. So go to the website, lipodrops.com, and get all of our official products. And thank you for tuning in tonight. We appreciate each and every one of you taking the time to spend with us in the Your Health is Important Ask Dr. MJ broadcast here on YouTube Live, Instagram Live, Facebook Live, all of the social media platforms. So tell all your friends, don't keep it to yourself, and remember, share this information. When you are out and about, you want to make sure when you're playing cards, when you're playing spades, when you're playing games with your friends, when you're at a family gathering, you're having a dinner, a group dinner with your friends, share this information. Tell them Dr. Collier said, and go to the website and hear it in the video of your own. That brings to an end this episode of the Ask Dr. MJ Why? Because Your Health is Important broadcast. That's here on Facebook Live, YouTube Live, Instagram Live, and all social media platforms. We'll see you next time.